Unit 5. The Science of Life. Exercise 15B, page 50.
Hello, welcome back to Health Watch. If you just joined us, with me in the studio is Dr. Alan Kilbane, and today we're discussing dealing with colds and flu. Alan, before the break you were saying that antibiotics do not actually kill viruses.
That's right, Ken. Antibiotics do not kill viruses. So if you have a viral infection, there's just no point in taking them. It is, in fact, quite harmful.
How?
Well, basically, there are two main types of germs that cause most infections. These are viruses and bacteria. Viruses cause all colds and flu, most coughs and most sore throats. Bacteria, on the other hand, are responsible for most ear infections and things like strep throat and infections of the urinary tract. Now, as I said before, antibiotics cannot kill viruses, and they can only kill specific bacteria. Now, each time you take an antibiotic, some bacteria are obviously killed. The more bacteria are exposed to antibiotics, however, the better they learn how to mutate in order to fight them. And this is how you get drug-resistant bacteria.
So they become like war veterans, tough to kill?
Exactly. Veteran bacteria, to use your words, do not respond to antibiotics and continue to cause infection. Each time you take an antibiotic, your chances of developing drug-resistant bacteria increase. Of course, if you have an infection which can only be treated with antibiotics, what can you do? You have to take them. But if you're gulping down antibiotics just because you have the flu, well, that's just pointless. You leave yourself more open to bacterial infections for no reason at all because, as I said before, antibiotics do not kill viruses, and flu is a viral infection. And don't forget, it's not just yourself who is harmed by improper use of antibiotics. Bacterial infections are highly contagious. So just because you have been using antibiotics without good reason, someone else will also have to suffer because of your, war veteran bacteria. Over the years, some bacteria have become so strong that some diseases that used to be easy to treat are now becoming nearly impossible to treat.
So when should we take antibiotics?
To put it simply, only when your doctor says that you should.
And when a doctor's advised to prescribe antibiotics?
Well, the World Health Organization defines the proper use of antibiotics as the cost-effective use of antimicrobials which maximizes clinical therapeutic effect and minimizes antimicrobial resistance. To put it in plain English, antibiotics should be prescribed in the right dosage and for the right length of time. It's quite a balancing act for doctors because avoiding overuse is not the only issue. Underuse of antibiotics is almost as dangerous for public health because it provides a perfect environment for bacteria to adapt and eventually become resistant. Many patients do not comply fully with their prescription. They discontinue treatments prematurely when they begin to feel better. Some even keep leftover tablets, saving them for later self-medication. Others simply forget to take the tablets or take them inappropriately in combination with certain foods that reduce the absorption of antibiotics in the stomach. To improve the situation, physicians have to take time to advise patients properly. In poorer nations, it is even more complicated because people often cannot afford a full course of treatment, share tablets with family members, or take weaker or cheaper counterfeit tablets. These are all larger issues. However, one thing that is easy for everyone to do is to never, ever take antibiotics without a doctor's prescription.